Welcome to the Anchor Your Retirement podcast. I'm your host, Barbara Gulin, hanging out with my fantastic co-host on this rainy, cloudy day is Tony Shore. How you doing, Tony?
I'm doing great, Barb. Thanks for asking, and thanks for having me on your show today. I think you've got a great one lined up for our listeners, an important topic. I want our listeners to pay close attention because I think this topic you have today is something that often derails people's retirement plans.
It really
If
can.
you don't plan ahead while you're still in your working years, this can be tough. So if you're in your working years or getting ready to retire or have just retired, this show is for you. But first, I've had a great week.
Good.
A huge thing, happened in the last 2 weeks. An opening came up at an assisted living apartment
Oh,
in the same that's
fantastic.
attached to the same facility where my mom has been for 3 years in full-time nursing home care. She has full-time
Mhm.
care, late stages Parkinson's, but my dad has been alone on the farm, this huge farm by himself,
Mhm.
insisting on trying to
We've
go out
talked about that. Yeah.
and get in the tractor and falling and just doesn't remember to take his meds. And at first, he didn't want to hear of it moving off the farm. And then the last year, he's like, okay, I'm going to start cleaning out the house, and they said maybe there'll be an opening this fall or next year. Well, I got a call. Hey, we got an opening and we have 70 people on the waiting list, but we're willing to move your dad up to the top for this apartment because your mom is already here and we know you and your dad. He comes and visits, everyone knows him. So
Yeah.
we'd love to offer it to him first, and it's a really great price considering it's one of the
Oh,
better
that's
homes in that area.
fantastic.
So he's moved in. We got him moved in over Memorial Day weekend, and
Sweet.
yeah, I'm so happy. It's a relief knowing that he has somebody coming in 3 times a day to give him his meds and everything. And otherwise, he's still on his own. He still has a license. He shouldn't be driving, but he does sometimes. And I'm hoping that he stops. He says he's not going to drive as much now. So
That's a huge weight off of your
yeah.
shoulders, too.
Yeah, it is. It is. Speaking of healthcare and retirement, it kind of ties.
Yes.
That's what
Yes.
we're talking about today, right, Barb?
It is. It is. Do you know what the average couple who's 65 years old is going to spend on healthcare in retirement?
What's that?
Fidelity did a study, and this is from back in 2022. So this is before we had a lot of these really big spikes in inflation.
Yep.
$315,000.
Wow. So if you reach the age of 65, the rest of the chances in retirement, what the average person's going to spend out of pocket is $315,000
Yes.
or about there.
Yes.
Yeah. Wow.
Oh, I
That's
stand corrected.
insane.
Yes, that was a study done in 2022. For those of you that are thinking about retiring earlier, remember that you're not eligible for Medicare until you're 65 years old, and you can
Wow.
only COBRA your health insurance, your group health insurance, for 18 months.
And that's expensive.
It is expensive because
People don't
legally,
understand. You're going to pay
yeah,
more for Cobra, that's for sure.
you can your employer can charge you up to 102% of the premium. And remember that your employer, especially if you're the employee, not the family, your employer is required by law to subsidize your health care and pay. Some states it's 50, some states it's 75%
Yeah. Yeah.
of that health insurance premium.
Yeah, I
So
think my employer, they pay about half in most cases or more of your health insurance. So once you retire, if you retire early, you're going to pay 100% of that for
mhm,
Cobra,
you
and they
are.
aren't going to pitch in for that anymore once you're not working for the company, typically.
No, no, you aren't eligible to stay on that group plan. You then have to go to healthcare.gov or obtain some sort of private policy
Sure.
until you're 65 years old.
Wow. Yeah.
However, there are some workarounds. There are ways that you can get on group insurance coverage
Hmm.
without going back to work. Um, and there's some tricks, some things that we'll talk about.
Sure.
There are employers that will allow you to be eligible for health insurance while working part-time. Places like Home Depot and Costco, you can get a part-time job there. and usually be eligible for the group health insurance. For those of you that really don't ever want to go back to work, but you need group health insurance coverage, you can become a part time college student. Did you know that?
Oh, wow. Wow. No, I did not.
The state schools, not necessarily private schools, but state schools offer group health insurance coverage to the students that are
Oh,
attending
wow.
that college. And most of the time, you're eligible for coverage if you are attending part time and have a declared degree.
Really? That's
Yes.
amazing. That's one aspect of this I have never heard anyone talk about, Barb.
And fun fact, college students are poor. Did you know that?
You know what? I do know that. I have 3 of my own. I was one once, and I
Yes.
now have 3 adult children who are poor
Yes.
because they're in college.
Because they're in college.
Right.
The student group health plans usually have a deductible of like $400 or $500.
Mhm.
And then usually it's an 80/20, and it's a PPO plan, which works out really well if you need coverage. Like with my family, we needed coverage in multiple states. The healthcare exchange doesn't necessarily, your individual health insurance plan, since the changes in the Affordable Care Act, might not be very good with out of network coverage, but these college plans are excellent because they're PPO plans. And so you have people in network all across the country. So if you
Mm.
want to travel, and most schools, if those of you that are wondering how I know so much about this, it's because this is how I've insured my family since 2014.
Wow. That's great.
Yes. I am technically a part-time college student, an English major this time around. Um, and it has worked out really, really well for us. Now that I have a larger staff and I have access to group health insurance through our employment organization, I will probably end up hanging up my college hat for a little while and join that group plan eventually. But so for the last 10 years, I have attended college part time, and I have managed to keep my family insured, and it has worked out for us very, very favorably. If you've got questions about that or how I did it, I'll gladly talk to people about it one-on-one. They can call us at our office, area code 913-553-6222, and go to appointments and scheduling, tell them that you want a complimentary consultation with me, and we'll talk about this. For those of you that don't want to go the traditional health insurance route, there are also organizations out there that are medical cost sharing groups.
Hmm.
A lot of them are faith-based. And there are some other organizations out there. It's not the same as health insurance. You need to understand that going in. But if you are reasonably healthy, it will cover you if something catastrophic happens. I think it makes sense that you go the traditional health insurance route with the way our healthcare is organized in our country
Yeah.
as much as possible. And again, here's that little fiduciary disclaimer. I don't know your individual circumstances, so don't make any decisions based solely on this conversation. But, check with a fiduciary, work with somebody who has extensive health insurance experience. A lot of things changed back in 2012 when the Affordable Care Act was deemed constitutional, and it really did overhaul the health insurance availability in this country, not always necessarily for the better.
Right.
If anything, it's made it more difficult. Just as an example, in Johnson County, Kansas, before the ACA went into effect, you had more than 20 or 25 carriers in the county, and you could opt in for health insurance either on the 1st or the 15th of any month. Now, unless you have a qualifying event, you've got that narrow window with the ACA to get coverage. And if you miss that window and don't have a qualifying event, you're shucks out of luck until the next year.
Hmm.
and you have far fewer providers, like probably less than 5 instead of 25 to 30, which limits your choices.
Yeah, it does.
It does. But that's just one component of healthcare costs in retirement.
Yeah, the component of if you retire before 65, what do you do?
Right.
That's what you've been addressing so far.
Right.
And then there's planning for the rest of it. Once you're 65, people think,
Mhm.
well, why do I need to worry about healthcare planning in retirement? Once I turn 65, I'll have
Mhm.
Medicare. And
You
end
will
of
have
story.
Medicare.
But it's not the end of story,
It's
and it's
not,
not
because
free.
Medicare doesn't cover everything.
And there
It
are costs.
There are. There are.
Yeah.
First of all, your Part B premium is gonna be based on what your adjusted gross income is. And if you are a high wage earner coming in and retiring at 65, there is an appeal process that you can go through to say, "Hey, my income is gonna be lower than what it was." But, for those of you that hear your financial planner or other people talking about IRMA, they're not talking about their great aunt on their dad's side. It is an
Oh, good old
acronym.
Aunt Irma. Good old Aunt
Aunt
Irma.
Irma, yes,
Yeah.
and this Irma has 2
I think
A's.
we still have a doily she knitted.
Doilies are usually crocheted, not knit,
Yeah,
just so you know.
whatever.
Well,
I've heard it both ways.
anyway,
No,
anyway,
you're right. They're crochet.
IRMA talk is the acronym that the government uses for their pricing scale for Medicare Part B coverage. The more money you make, the more it's gonna cost you to participate in Medicare Part B. And most of us need Medicare Part B because Part A
Right.
covers your hospitalization. Part B is those routine doctor's visits and your outpatient healthcare. So it's not something that you want to forego. And then on top of that, people also get a Medicare supplement because Part A and Part B aren't going to cover all of your out of pocket costs.
No, there are certain things Medicare just doesn't cover: hearing, vision, dental, long term care.
Mhm.
Yeah.
Prescription drugs. That's
Prescription
why you
drugs.
need Medicare Part D, which also has an increased price,
Sure,
according to IRMA.
there are still premiums, deductibles, copays, prescription copays and costs. People don't realize that. I think a lot of people just put off thinking about it. They don't think about a lot because they just think, well, I have Medicare. They
Well,
just
and they take it for granted that it's gonna run basically the same way it does while you're on your employer's health insurance plan,
yeah, it
and that's
doesn't.
not necessarily the case.
Right.
But there are ways that you can start saving and preparing for those things even before you've retired to help reduce your out-of-pocket costs or to, um, have set aside that money in that nest egg. Okay. One of the ways you can do that is through getting a health savings account. And if your employer offers an HSA plan, I strongly encourage you to consider that, especially if you're healthy and you don't have a lot of out of pocket medical costs. HSAs allow you to save money in a specific account called a health savings account. Okay. You can put the money into that HSA and get a tax deduction for it.
So it goes in tax free. It's
It goes in tax
pre-tax.
it goes in pre-tax, it goes
So
in
that money will be
tax-free.
taken off what you have to report on your earnings. So that's
Right.
a big tax advantage there. It goes in tax free to the HSA, and then it can grow within that HSA,
It
right?
can
Earn
grow within
interest.
that HSA. Many, HSA providers, once you meet the minimum threshold, they want you to have your deductible in something that's like in savings so
Sure.
that it's not gonna fluctuate with the market. But over and above that deductible, they have investment options for you where it can grow significantly depending on how it's invested. But the
Right.
best part about it is guess what? When you pull that money out for qualified medical expenses, it's also coming out tax free.
Wow. Yeah, and I know that they've expanded what it can cover. I mean, it covers a lot of things, not just
It
doctors'
does.
bills, right? It can
It
cover
does.
over the counter items, right?
It
Yeah.
can. And here are some of the other things it can cover. My advice to people is always if they have an HSA, to fully fund it and then pay what they can out of pocket, even though they have the HSA. Because once you are on Medicare, actually, once you separate from service, you can use that HSA to pay for those health insurance premiums. You
But you
can use
no
your
longer contribute once you stop having earned income, or once you go on Medicare off that company policy, then you can't contribute anymore.
That's
But the
true.
HSA, you don't lose that each year, and you
You're
don't
not
have to
gonna lose
spend
it.
it.
You
There's
can
no
carry it
time
with you in retirement. There's no
for as
time
long as
limit
you
to
live, right?
it.
Yeah.
And the things that you can use to pay for it in retirement are things like your Part B Medicare premiums,
Yes.
your Medicare supplement premiums. Okay.
Copays, hearing aids.
Right,
Yeah.
right. I mean, for those of you that go on Medicare at 65, but for whatever reason you haven't started taking Social Security, because once you start drawing Social Security, they're going to pull that Part B premium out of your Social Security check.
Yeah.
All of those, there are so many things that you can use that for in retirement. Some people have referred to an HSA as a Roth IRA on steroids,
Right,
simply
because it's the
because
only designated IRS account where you put money in tax-free and get a tax break up front, and it also comes out tax-free. You never have to pay taxes on that money. It's the only account like that.
that's right.
With a
It is
Roth, you have to pay taxes up front and then
with
put the
it
money
going in.
in.
Yes.
Yeah, and with a traditional IRA, you get it to put it in tax-free, but you pay taxes when you take it out. And HSA, however, it's the only one that allows you to put it in tax-free, get the tax break now, and it comes out tax-free. And people say, well, yeah, but I have to use it for medical expenses. But I think of what you said at the beginning of the show, Barb, and that is you're going to have the average American couple
Mhm.
spends $315,000 on
That's
medical
right.
expenses in retirement.
That's right. And, like an IRA or a Roth IRA, there are limits to how much money you can put into a health savings account every year, depending on whether you have an individual
Sure.
plan or a family plan. And those are indexed for inflation, just like IRAs are.
Yeah.
Okay.
But if you
But,
load that up as much as you can,
right. And like I said, if you load it up and you keep the money there and you pay those other expenses out of pocket without going through your HSA, if you save those receipts and have it all documented, did you know that when you retire, you can reimburse yourself for those and pull that money
uh,
out tax free and use it for something like a cruise or a
yeah,
vacation?
yeah,
But we're
the
going to
vacation.
keep that quiet.
Take the kids to Disney, right? The grandkids or something.
Take yourself to Disney.
Yeah, there
Bring
you go. Leave the kids. So,
So, and there are all of that is legal if you can prove that you paid those expenses out of pocket. The IRS is going to allow you to pull that money out tax-free to reimburse yourself for medical expenses that you've already incurred, as long as those expenses were incurred while you had the HSA.
huge. That's a huge
Yes.
vehicle and solution to costs, healthcare costs in retirement.
It is. It is. Now you will notice the one thing we haven't really talked about, and because I'm not a fan of it, is long-term care insurance.
Hmm.
For those of you that have a group long-term care policy or you bought a long-term care insurance policy a long time ago, this is not me telling you to go out and cancel that policy.
Oh, yeah, no.
It is me telling you that if you are considering that you need long-term care insurance, like I have clients that have a group plan. They may or may not have a family, kids that they would want to rely on to take care of them. They might not want to impose on their kids. Um, eh, if you've already got it in place, I'm not telling you to get rid of it. If you're considering that you might have a need for it, let's look at some other options that have other benefits attached to it in addition to that long-term care insurance.
Like a
things.
cash value life insurance policy?
Exactly, exactly. If you are in good health, when you qualify for that cash value life insurance policy, many of them have a long-term care component attached to it. It's not long-term care insurance, but you can access that cash value, and the IRS has an allowable per diem that they can take out on an average daily basis. They can take that out against the cash value and use that for long-term care. It's not going to deplete the cash value. There will still be a death benefit of some sort. So you're not that, it is going to decrease the death benefit, but it won't completely erode the death benefit, and gives you a way to be able to supplement your long-term care expenses without putting all of your money into that one basket. Because if you put money into long-term care insurance and you just fall asleep one night and don't wake up the next morning, do you know how much money your beneficiaries get from that long-term care policy?
Zero.
Zero. It's just like car insurance.
And long-term care insurance, if you put it in there and don't end up using it, it costs a lot, and that's a lot of money to pay for nothing if you don't need it. Now, the majority of Americans probably at some point will need long-term care. At least if they live till 65, the odds of them needing long-term care are about 70%. It's almost 2 out of 3. So, but I see your point, and correct me if I'm wrong, Barb, but it's getting harder and harder. Fewer reputable companies are even offering just straight long-term care policies anymore, right?
That would be accurate because of the costs associated with it. And once a claim is filed, a lot of insurance companies that offered health insurance, or I'm sorry, long-term care insurance, are what we call in the industry redlining in that division of their company, which means they've got more that they're paying out than they have coming in, which is not a good thing for insurance companies.
No.
That's not how they're designed to work. So a lot of them are choosing to just get out of the industry altogether.
Yeah.
If you don't think you can qualify for life insurance, or if you have issues that would prevent you from getting life insurance, like if you had cancer or something like that, if you have recently been diagnosed with cancer or recently come out of cancer treatment, it's going to be very difficult to convince an underwriter to give you life insurance. Many other fixed indexed annuity companies have provisions in their contracts where if you've held the contract for at least a year, for some companies it's a little bit longer than that, if you are diagnosed with a terminal illness or require that long-term care or assisted living with the correct documentation, you can be released from that contract, including bonuses and interest that you've been credited, and then have that money to utilize for your long-term care coverage as well. But
yeah, and I know on almost any of these insurance policies, like life insurance or a fixed index annuity, that a lot of retirees use those. You can get a long-term care rider, right? That will kick in some money if you ever need long-term care.
yes, that's correct. Like I said, some carriers release the contract in its entirety.
Okay.
So, others don't release the entire contract, but they might release a portion of it for
Sure.
you to be able to use over and above what your free annual withdrawal amount would be.
Yeah.
But if you've got questions about this, you need to talk to a qualified fiduciary who understands how these policies and contracts work and help design a plan. I'm talking to those of you out there that are in your 40s and 50s, that you're heading toward retirement. I think people in their 40s really finally start to sit there and go, holy cow, I better start paying attention to this.
Yeah.
And making those plans, and things like a health savings account and fully funding that and utilizing that can help you make up for that lost time if you haven't been saving for retirement as diligently as you wanted to for whatever circumstance. I don't know about you, but we found out that kids are really expensive and
They are.
they can derail savings plans rather quickly.
Yeah.
So When you're looking at this, there are definitely tools that we have in our arsenal to help you prepare for that healthcare cost in retirement. Obviously, the best defense is a good offense. So taking care of yourself, eating right, continuing to move your body, and staying healthy is going to be a tremendous benefit to you in the future. But things happen.
Yeah.
So, for me as an advisor, I always want to make sure that we're doing what we can to cover the bases, and making sure that if we don't end up not needing those bases covered, that your beneficiaries and your family and your heirs still get to benefit from your hard work, that we haven't just wasted that money.
Yeah. Yeah, that's good to have a plan that will do that, right? It's there if you need it. And if you don't, hopefully your loved ones can benefit from it. And you should have a plan in place that allows that. But the key here to everything you've been talking about, Barb, is working with someone like yourself, a fiduciary, a financial professional. Make a plan and make healthcare a part of your retirement income plan. That's the bottom line.
Putting together a plan is essential. You can't just come to me with a bucket of money and say, okay, I'm ready to go.
Right. Right. You need a plan for every aspect, healthcare, Medicare, and retirement. In fact, speaking of Medicare
Mom, that's for my Roth IRA.
Whoop, not a Roth IRA. How about this?
I'm talking about Medicare, for God's sakes.
Medicare co-payments for a year.
I'm going to take away your sound bites.
Yeah.
I'm going to take away your sound bites. You're having too much fun.
I try, but an important topic, Barb.
It is.
So how can
It
our
really
listeners get a hold of you to set up that consultation?
They can always reach out to us on our website. That's anchoryourretirement.com. Or you can call our offices. I'll give you the number again. It's area code 913-553-6222. And reach out to the appointments and scheduling line, and we will be more than happy to get you on the calendar, sit down and visit with you one-on-one, and help you understand what those options are for you in retirement.
All right. Well, thanks, Barb. Great show today. And
Thanks,
again,
Tony.
listeners, no problem. Again, listeners, that number is 913-553-6222. And that does it for today's episode of Anchor Your Retirement with our host, Barbara Gulin.
We'll see you soon.